On July 14, 1970, the New York Young Lords, a revolutionary community group composed of young Latino and Black New Yorkers, occupied Lincoln Hospital in the South Bronx for 12 hours, demanding better care, improved conditions, and a variety of patient and worker rights for the communities of color that the hospital served and employed. The hospital had become a symbol of all that was wrong in healthcare facilities in inner city communities. While these demands for a people's hospital were made more than half a century ago, their relevancy for New York City remains undeniable. Death rates are 30% higher in the poorest New York neighborhoods than in the wealthiest ones, which also have much higher life expectancy rates. Nearly 3/4 of emergency room visits in New York City for the poor were for non-emergent healthcare needs or could have been treated in a primary care setting. Access to healthcare continues to be a profound issue as the cost of living in the city has forced many New Yorkers to opt out of insurance because of high costs. That's just the tip of the iceberg. Since 1965, the East Harlem Council for Human Services has attempted to make a dent in these statistics, providing fully bilingual health and human services to the underserved East Harlem community. We're honored and blessed to have Dr. Adam Aponte on the Radical Imagination today. He's the Chief Medical and Executive Officer for the Boriken Neighborhood Health Center, located in El Barrio at 123rd Street and 3rd Avenue, just about 20 blocks from our studio. Mm-hmm. He's gracious enough to visit us today in person on the show to explain the comprehensive service and treatment plans of the patient-centered medical home he directs. With a staff fully knowledgeable and aware of the community they serve to provide the best possible health care for El Barrio. So tell us a little about how this got started. We were talking a little about the war on poverty in the 60s and community health centers and so on. So this is a vitally important facility for, as I said, an underserved community.
Correct.
So necessary.
Correct.
How did we all get started on this?
Yeah. Well, thank you for the invitation, first of all, and appreciate any opportunity we get to shine a light on the work that we're doing, and not just us, but what we describe as the FQAC movement, Federal Qualified Health Centers, which is what we are designated as. So, just to go back, as far as Federal Qualified Health Centers, I'll give you that context first.
Okay.
These were created in the 60s. This was the war on poverty under the Johnson administration, when there was a recognition that we needed more health services in certain communities. And so as part of that war on poverty, the Johnson administration created these community health centers. Mm-hmm. The first of which, the two were in Boston and in Mississippi. And one of the founding fathers of this movement was Dr. Jack Geiger. Many folks know Dr. Geiger with his work in terms of community health centers, and realized that it's better to get into the community to provide health care than to sit in the brick and mortar of a hospital and wait for folks to walk through these sort of outpatient settings.
Yeah.
Really
not getting the care they needed, leading to people like Felipe and
correct.
The young lords.
Not getting the care that they need,
horrible.
Getting very fragmented care,
exactly.
not providing comprehensive primary care services. I mean, hospitals are great for emergency stuff. Hospitals are great for, when you need surgery, but they're not so great when you need basic fundamental primary preventive care services, which is the focus of FQAC such as ours.
I see.
So the movement started back in the 60s and continues today. Today there are about 1,400 FQACs nationwide. They serve about 31.5 million individuals. That means 1 in 11 individuals in this country get their care at FQAC. In New York State, we serve about 2.3 million individuals in New York State alone, which is about 1 in 9 individuals. And if you look at statistics and you look at poverty levels, you can argue that 1 in 3 Americans should be eligible for healthcare in community health centers. And that's something that we're sort of focusing on, making sure that we capture everyone. Everyone gets the right to healthcare. We believe in that right to healthcare, not a privilege. So the East Harlem Council for Human Services, which is our corporate name, was founded Similar to many things in this community, grassroots efforts, people came together around the time, started focusing on the social issues.
Again, it was back in the mid-'60s.
This is mid-'60s, correct.
Okay.
This is actually probably about 1964 or so when the group got together, a group of individuals from East Harlem, and said, what do we need to do better for our community? We need to really take care of ourselves because we're not being taken care of by others. And they focused again on a lot of social issues. Some things that we talk about today, just poverty, war, crime, poor housing conditions, all these things that today people might describe
structural violence that poor people were experiencing.
Exactly.
That manifests itself certainly, obviously, in medical and mental health issues.
It leads to a lot of these
Crime,
issues.
violence, all kinds
Correct.
of things. Yeah.
They're all interrelated.
Nutrition, yeah.
They're all interrelated.
Yeah.
And so they focused on that. And one of the very first programs actually that we created was our bilingual Head Start program, which, by the way, also was a program that was funded under the Johnson administration during the war on poverty to get children access or parents access to early education. And so we still run our bilingual Head Start programs. We have two programs in East Harlem, one on 116th Street and 111th Street that we've been running. It's very unique because it is a bilingual program, and we felt that that was very important in the East Harlem community. We all know East Harlem is traditionally a Latin community. At that time, it was mostly people from Puerto Rico. Now we have a whole potpourri of folks from Spanish-speaking countries that live in this community, but it's predominantly still a Spanish-speaking community.
Sure.
And then shortly thereafter, folks realized that access to healthcare was also limited. And at that time, despite the hospitals that surrounded us, Metropolitan Hospital, Mount Sinai,
On
was
100th Street.
Yeah.
So it started with Head Start.
It started with Head Start.
And began to grow and see the need for other.
Correct. It created other programs based
Right.
upon, again, what they felt the needs were.
Got it.
And a big need was healthcare.